Hey everyone, Farmington Mayor Nate Duckett. Thank you for joining us today here on the Mayor's Table. We have a special episode with CEO of San Juan Regional Medical Center, Jeff Bourgeois, and Chief Medical Officer, Dr. Bob Underwood. We're going to be talking about statistics at the hospital, trends, and how we continue to work to keep our numbers under control. Stay tuned. Hey everybody, Farmington Mayor Nate Duckett. Thank you for joining us today for another episode of the Mayor's Table. It's August of 2020, and I have some special guests with me today. We have the CEO of San Juan Regional Medical Center, Jeff Bourgeois.
Good morning.
Thanks for being here, sir.
My pleasure.
And we also have Dr. Bob Underwood from San Juan Regional Medical Center. Bob, thanks for being here.
Sure, absolutely.
We wanted to give kind of our viewers an update on things here that are going on at the hospital in regards to COVID, the different measures that you all are still taking, and kind of update us on some statistics and trends. And, you know, I know, Jeff, that you do a weekly update there, so we're kind of replacing that right now.
That's right.
But it's August. Well, this was actually recorded July 30th, just to make sure we're being transparent. So any information shared today would be accurate up until really July 29th to be.
Actually, I do have some statistics from this morning, July 31st.
Oh, it is July 31st. I don't know why I can't get my days right anymore.
Yeah.
I'm always a day off.
I think we're all in that boat with this.
Oh, yeah.
COVID has messed up all of our calendars.
It really has. Well, Bob, it's like, for me, it's like Groundhog Day.
Yeah.
Every day I get up, I'm like, what's going to be today? Probably the same thing that happened yesterday.
I think a lot of us are feeling that right now. Yep.
Well, thank you, gentlemen, for joining me. So, Jeff, I'll kind of let you kick this off and give us an update on what's happening on our COVID unit and different things the hospital's working on right now.
You bet. Well, thank you, Nate. I'm happy to be here. Thanks for having both of us. Just wanted to, on a couple of key points, make sure that the community knows that our hospital and our clinics are open, and we're happy to receive patients. Our surgical, procedural, and outpatient diagnostic schedules are open in accordance with Department of Health rules. We're using COVID-safe practices, so please contact your physician offices. And most importantly, know that the urgent care and emergency department are open to help you in times of emergent and urgent needs. Don't delay care if you need it. We've seen some cases where people who, for really unnecessary reasons, were concerned to come to a hospital, either here or countless stories across the country where people are delaying care. That's not the right thing to do. We are able to take care of both COVID and non-COVID patients in safe and efficient manners. We ask that you do, if you have a scheduled appointment, show up early enough to make sure we can complete a screening process and know that we'll take good care of you. In terms of what's going on statewide, we're seeing hospitalizations on a statewide basis kind of hover between 150 and 170 on a day-to-day basis. That's certainly down from our peak in mid-May, but a little bit above the trough we saw right at the end of June. Some good news for our county, and particularly what we're seeing at the hospital, is that countywide, as of last week, there were 84 new cases diagnosed countywide in San Juan County. That's the lowest since early April, really. And Mike Mestis at the county does a great job keeping us updated on that. One number we look at every day at the hospital is our rolling 14-day average of positive cases. So what percent of those patients have we tested over the past 14 days are positive? We now have that number as of this morning below 7%. That's the lowest it's been since April 4th.
That's great news.
Yeah, we're happy to see that.
Jeff, real quick, how many tests are you doing a day right now at the hospital?
We average between 50 and 60 tests a day at the hospital.
Okay. And put that in perspective, I believe the state right now is at 5,000 or pushing 7,000, I think, is what the governor mentioned this week. And you had said that they're looking at going to a $10,000 or 10,000 tests a day mark. Is that right?
Well, that would be the statewide goal later this fall. There's a lot of logistics to organize to make that happen, as well as making sure the supply chain that would supply the state with the actual testing materials, both the swabs as well as the testing cartridges for the lab equipment itself. And so it'll be a challenge to get there, but their goal is to really try to expand testing to that level.
Bob, real quick on testing, and Jeff, I didn't mean to interrupt your presentation there,
Very
but
good.
I think it's a good segue. Just in regards to testing, and right now at the hospital, are we testing asymptomatic people? I mean, if you come in and you don't have symptoms, are you getting a test currently?
So if you come in and are going to be admitted for any reason, then we will test you. And so let's give an example of an orthopedic procedure to be done that's going to end up staying overnight. We'll test under those circumstances. But otherwise, if you come in perhaps to the emergency department, if you are not showing signs or symptoms of COVID-19, then no, that we would not do a test on a patient like that.
Okay. And then we stopped the drive up testing for San Juan
Correct.
Regional Medical Center. The state is still doing some of those with in their public health department. But as I understand as well, that across the state, we're seeing the major hospitals, they're no longer testing asymptomatic people, which I'm guessing is really due to the lack of supply of tests, is what I would imagine, or is there other reasons?
It's a combination, but that is a big player, certainly. If you watch the news, everybody recognizes that the number of cases across the country is actually going up. We may be having a respite here in San Juan County, but across the rest of the country, the demand for those supplies to be able to test is going up. And so we're developing strategies at our organization to try to increase the capacity for doing testing, limiting where we do them, but also taking some other strategies using other testing modalities. Because the supplies, the companies that make those testing kits, their demand is skyrocketing, not
Sure.
because of us, but because of other people.
Wow, I mean the global
Right.
demand for it, and of course that plays out in the labs as well that are having to run those tests through. Which is when you have your own machine in the hospital to get you the results, it makes such a big difference
Right.
from doing that. But I know that test kits and PPE are something that's a big concern. We've heard that from the White House. We've heard it from Dr. Scrace here in New Mexico.
Yeah.
And we'll have to see how this all plays out. But Jeff, if you could, go ahead and continue with your update, specifically in regards to what we're looking at on the COVID unit floor. Because it seems like we've seen some ups and downs, but the numbers here recently seem to be improving on the COVID unit.
They are. And again, much like the state, our peak inpatient census was back on or around May 15th. Today, as of Friday, July 31st, Nate, we have 19 confirmed COVID positive patients on our fourth floor COVID unit, and another 7 that are what we call a patient under investigation, so pending a test result or they're otherwise symptomatic. So a total of 26 on the floor. The good news is only 2 of those 26 are intubated.
Interesting.
And that's one of the lowest numbers we've seen in our COVID ICU for 3 months or more. So there's a general sense, and you almost hesitate to say this out loud, but that the acuity, how sick a COVID patient is, what we're seeing is those that are still needing a hospitalization are not as sick as we saw early on in our pandemic response, where we had a lot of ICU admissions and some very, very sick patients.
Does a lot of that have to do with the age of the average? We're seeing it in younger patients now, and there's a larger percentage they're carrying as opposed to our senior citizens.
That's some of the speculation that's out there right now. And certainly, yes, age, comorbidities, other disease processes that a patient may have compounds the medical scene, if you will, for the provider trying to take care of that patient. And we are seeing a decrease in the average age of infection.
Okay. And all that can change.
Yeah.
That I think has been kind of the ongoing component that may be more frustrating for people just on a daily basis, is you think things are improving and then all of a sudden something gets worse, but it may not be getting worse here, it may be getting worse somewhere else, but where it's getting worse somewhere else may impact your daily life here.
Right.
So trying to keep everything in perspective, and I think from the very beginning of this, we've had that mindset of you got to focus on what you can control and work on that. All these other things out there, you can't do that. And controlling the virus, this has been obviously an important component from day one. the first thing we did is we stayed home as much as possible, and we could see the traffic counts here in the city. We were watching them on Main Street, and they just kept plummeting throughout April. And then as things started, people started feeling more comfortable with it, things started coming back up. Restaurants, of course, are still, you can't dine indoors. We can't go to the museum still. We can't do much of what we do with the programming at the library. We can't swim in our pools. There's all these things we can't do, but there is still a lot we can do. And I challenge people to consider that there is plenty out there to do, and you just had to make some shifts in your life on what those things are maybe that you normally did in the summer. But there is some components here that we want to make sure that we're talking about today that deal with how we continue to keep those numbers low and keep pushing them down. And there are certainly things individuals can do. And I wanted to make sure, Dr. Underwood, we talked about that. So has anything changed in the protocols and how we should be dealing with this?
And not really. You've heard it probably a million times, literally, in the last 4 months. But washing your hands is huge. Also, wearing a mask and social distancing, physical distancing, whatever you want to call it. And it all has to do with how far a droplet goes, or obstructing the flow of a droplet when you speak or when you cough. Then there are small fluid particles that contain virus if you're infected. So there's a couple of components of that. So we wear a mask to protect other people more than we do to protect ourselves. And as we were talking before we even started the show, that there seems to be, and evidence is mounting, that people are shedding virus for about 2 days before they themselves start to show symptoms. And so you can unknowingly, without wearing a mask, be shedding that virus and infecting people around you, even when you don't mean to. That's why we recommend that you just wear one everywhere you go. It's recommended from, as a matter of fact, a joint statement from the American Hospital Association, American Nurses Association, the American Medical Association just this morning, that they do support this as a primary effort to slow the spread of the disease. So, you wear a mask, maintain appropriate distance between people, and make sure that you're washing your hands. And it sounds so simple. And the mask is they're out, they're comfortable to wear. And really, it's just to stop the spread of that droplet as you speak from getting to somebody else. It inhibits the travel of the droplet carrying the virus.
Sure. I think it's important in anything that we're doing. People are going to analyze information, and they're going to choose to accept it or not to accept it as fact or not fact. I mean, there's so much noise out there. That's why I wanted to bring you guys in today to talk about it, because there are some factual components to it that do make sense, and I think people get that. We've certainly seen here in Farmington, I would say at least 85-90% of people in public places are wearing masks. And so, I think that's, if you look at the numbers, certainly it's had some impact. And for the grocery store workers and individuals that are there every single day dealing with large crowds of people, we're not hearing about a lot of those folks getting sick. Rapid response testing happening, at your local Albertsons and those kind of things. So it makes me feel confident, but understanding that we've got to continue these things until when? The vaccine is still up. The questions are still there as the timing of all that.
Sure.
Goodness, the headlines, if you just read headlines, you just bang your head on the wall.
Yeah, it's actually, so the CDC also released something earlier this week talking about vaccine. We actually have a number of vaccines that are in what we call stage 3 trials, where it's like thousands of humans that are being inoculated with the vaccine. And now we start doing the statistic analysis of whether or not they get sick. So there are 3 of them. And to think about the fact that at the beginning of this year, we didn't even know about this virus, and we already have a vaccine in stage 3 trials. I like to tell people that this is the equivalent of the moonshot when it comes to immunology. To have all of the resources, money, time, to be put into this to where we already have vaccines that are at that level of trial is absolutely unprecedented. We would be years down the road in any other circumstance.
Very interesting.
Yeah.
It's like a moonshot.
Yeah.
Well, Jeff, I want to tell you, we're here today just so folks know. We're social distance here.
Right.
When we opened the doors, you gentlemen obviously walked in, had masks on, and so everybody's practicing these good habits. And I want to say thank you to you and your staff and the nurses and the doctors, Dr. Underwood. everybody up at San Juan Regional and throughout all these medical clinics here in town. I know everybody's taken, they've had to go above and beyond really to protect themselves and then protect their families when they go home. That's the other part. I have a wife who's in healthcare, and there is a protocol of when she comes back inside the house of things that she does to ensure that she's minimizing any potential spread to the rest of us. And I think we're going to have to see those things with school kids as well. When they go back into the school buildings, there's probably going to be those protocols that need to be put in place at mom's house or grandma's house or at the daycare centers, whatever the case may be. And so it's going to be all sorts of new habits and things that nobody ever thought we would have to do. Right. So, Jeff, any other updates that you want to provide today from San Juan?
Nate, no other updates, but just to reinforce the importance of those very three simple practices: washing your hands, wearing a mask, and whether you believe it or not, if it can help potentially protect others from getting infected, then why not? We have worked so long and so hard since April in this community to get our numbers down. We've got the trend going the direction we want it. Let's not let our guards down and fall back, because as you touched on earlier, Nate, this can go the other way again if we let our guard down. So we just really implore everyone to practice those very simple three things: social distance, wash your hands, and wear a mask. Let's protect ourselves and each other and do everything we can to get this as far behind us as quickly as we can.
Sure. Dr. Underwood, any other follow-up statements?
I just want to reach out, as you did just a minute ago, to the people that I work with every day. I mean, the level of engagement of our staff at the hospital. The folks have gone above and beyond, as you said, doing things that they never thought that they would be doing. We talked about having a big pandemic years and years ago. I won't say how many when I was in med school, but still, near the end of a career, you thought it would never happen in my lifetime, but it has. And our staff at the hospital, the physicians, the nurses, the respiratory therapists, have really just risen to the occasion, and it makes me proud every day to know that I work with such a team.
Kudos to them. And it's going to be kudos to a lot of other people as we move through this new school year as well, and we'll all face new challenges in that regard. I certainly continue to pray for our community and our country and for the people that are here, and I just ask people to be kind and patient and understanding and think about others, in their daily activities, because it does make a difference. Mm-hmm. And I truly believe that when you're service-minded, thinking of others, it makes it easier to go through life. And you're making a difference not just for yourself but for those around you. So, well, gentlemen, thank you for giving us this opportunity to get the community updated. I know you're doing a great job doing that on a weekly basis at San Juan Regional Medical Center. We just appreciate all that you do.
Well, Nate, I want to say thank you for having us, but more importantly, thank you for what you do for our city and our community. I mean, yours is a voluntary position. You asked for this job. Remember that?
Remember that.
And I think we owe a lot to our public servants who step up to give their time to help lead our community. So I really appreciate what you do.
Oh, I appreciate that, Jeff. Thank you very much.
Thanks, man.
Well, and thank you all for joining us here today on the Mayor's Table. Lots of new information coming up in regards to economic development on our next episode. So we'll see you in a couple weeks. Until then, wash your hands, stay social distanced, and wear a mask. Right?
Well said.
All right. Thanks for tuning in.
Thanks. You.